May 12th is the International Awareness Day for chronic immunological and neurological diseases. Today I'd like to talk to you about two of these conditions. Raise your hand if any of the following things have ever happened to you, and then go ahead and raise your other hand if I name a second thing you've experienced. Have you ever broken an arm, fell down the stairs, been stung by a bee, had a bad toothache, had the flu, stubbed your toe, had a bad sunburn, scalded yourself with a hot drink, lost your voice, been in a bar fight, had a fever for more than 3 days, hit your funny bone, had a kidney stone, had a baby, or maybe been in a car wreck? All of those things have the potential to cause pain or distress, and they probably landed you somewhere on the pain scale. Pain is relative. What I feel may differ from what you feel, and the events surrounding the cause of the pain can affect how each of us might rate it. For perspective, women going through childbirth often rate their pain in the 6 to 7 range. Patients suffering a kidney stone might rate themselves in the 8 to 9 range. And most doctors or nurses feel that if you reach a level of pain where you lose consciousness, then that's when you've hit 10. Fibromyalgia and myalgic encephalopathy patients live with pain daily. They sometimes rate themselves in the 6 to 7 range after completing an average task, such as climbing stairs or taking a shower. And although they are two different conditions, they have many overlapping symptoms, and the major one is pain. Let's break these two conditions down a little. There needs to be more focus on the names. First of all, fibromyalgia. Fibro, fiber, fibrous tissue, myalgia, pain. The body is made up of epithelial, muscular, connective, and nervous tissue. Fibromyalgia patients feel pain in all of those things every day, sometimes all day. Part of their diagnosis comes from demonstrating that pain by measured pressure applied to 18 tender points throughout the body. Typically, a patient will also go through a battery of tests to eliminate other conditions. They need to show that applied pain at 11 of the 18 tender points for an ongoing period of time. Artist Frida Kahlo is suspected to have lived with fibromyalgia after surviving a terrible car accident. She often expressed her pain through her art. Myalgic encephalopathy is a condition with many names. You most commonly hear it called chronic fatigue syndrome. Chronic fatigue is misleading. This is far more than just needing a nap. It is fatigue in the most graphic use of the term. Your muscles will stop understanding or responding to the instructions your brain is giving. Other symptoms include a sore throat, to the point of not being able to swallow food or drinks, enlarged lymph nodes, and widespread muscle pain. Nurse Florence Nightingale spent the last 40 years of her life bedridden to symptoms of chronic fatigue syndrome. The awareness date for this illness was chosen because it's her birthday. Combined, there are hundreds of symptoms and several overlapping conditions that leave FMS and CFS patients anywhere from annoyed to fully disabled daily. And looking back at that pain scale, they're living their average life trying to manage this pain along with all these other symptoms, and they're rating their pain at a 6 to 7. Men, women, and children can all be affected by either of these conditions. However, women are 3 times as likely to develop them, and they often develop them in their 20s, and they see a diagnosis in their 30s. I am one of these women. I live with both FMS and CFS every day, all day. If you follow me on social media at all, you know that I like to post about food and my obsession with unicorns and mermaids, and if I think I'm having a good hair day. But I also post a lot about pain. I post a lot about exhaustion and the frustration of trying to live an active life with an inactive body. I've been asked, how would you describe what's happening inside your body right now? Because you look fine. And my answer is, here be dragons. In historic times, when a map maker wanted to warn of uncharted territory, they put in drawings of wild beasts and monsters, and the phrase, here be dragons. And I feel like that describes me, because for the most part, it feels like dragons are fighting inside me. They're tearing away at all those muscles and nerves and tissues. And I also feel that finding my diagnosis and treatment has been a journey through uncharted territory. I relate to the phrase so much I went so far as to have it tattooed on me as my last defiant act against my illness. It validated that although I have pain that I can't control or stop, I could engage in this painful event that I could control. I acquired these conditions almost 18 years ago. While I was pregnant, I developed a viral and bacterial infection that lasted 16 weeks. The infections were doing damage to my body. This resulted in delivering my daughter prematurely at 28 weeks. She was this tiny little creature. She couldn't breathe on her own. She had meningitis, but she also had a fierce will to take on the world. And she survived. She beat the odds, and she's healthy and strong and succeeds at everything she does. What we didn't know while we were focusing on helping her past those NICU days was that the pain and fatigue I was feeling was more than just postpartum symptoms. The infections had been treated, but the damage had been done, and my body was never going to be healthy again. So once you accept that you're never going to be healthy again, how do you face this idea that you're going to lose the ability to live a normal life? That getting dressed or brushing your teeth or cutting your food will become challenges that you struggle to overcome. And that every time you decide to take on a challenge, you'll have to do it with pain. I learned that first I had to know that life is not kindergarten. You are not a pack of gum, and you don't have to give a piece of yourself to everyone in the class. You do not have to let yourself get chewed up and spit out. I also learned that you'll face your illness alone. Your friends, your family, your coworkers, they're going to struggle to understand, but like you, they're going to become tired of trying to work with something they can't comprehend. When they come to hear Be Dragons on the map, they turn away. Because they don't know what else to do, they begin to respond to everything with "I'm sorry." Because they don't know what to say. But after a while, you don't want to hear "I'm sorry" anymore, because you know they're not sorry for something they did, but that they feel sorry for you. No one wants to be an object of pity. What I hope that people around me will learn is that when they come to the edge of the map, when they don't know what to do or what to say next, they should just say, "I love you," because that's what we all want, is to be loved and valued and valid. So now, look around. Do you still have your hands up? I never said you could put them down. But I'm sure after the first minute you slowly lowered your arms. You felt tired, or your shoulders ached, or your hands got cold, or you just plain felt silly with them in the air. And I know exactly how you feel, because most days, all day, while the dragons fight inside me, I also feel like I have my hands up, and I am tired, and my body aches, and I just feel silly. And these things, they feel so visible to me, but they're invisible to you. You have to have a reason, a motivation to keep your hands up, to keep reaching and moving forward. And my reason is that tiny little creature that knew on day one that she would succeed. I keep moving forward, so I could be there to watch her learn to walk and talk and excel in school and become an accomplished artist. And the times I feel the pain the least are the times where I'm focused on how proud I am of her. So I ask you, keep your hands up. And if anyone asks what you're reaching for, use that moment and realize my voice matters, your voice matters. Tell them you're reaching for better treatment, you're reaching for a cure, you're reaching for a reason to be valid. So keep your hands up and help make the invisible visible.